Hi, my name's Leah Scarpelli. I'm a professional women's soccer player for Brooklyn FC.
Hi, I'm Allison Pantuso. I'm a professional footballer with Brooklyn FC.
We're here at NYU Langone Center for Women's Health. We're here with our team doctor, Dr. Campbell.
Today, we're here to discuss the medical side of being a professional female athlete.
What's a myth you've heard about female injuries in sports?
I guess, I don't know if it's a myth, but is it true that you're more likely to do your knee on your period? I've heard that one. I don't know if it's true.
I love that one. I hear that one all the time. So there's a lot of studies looking at that. None of them are great.
Okay.
Basically, it's the opposite. So when you are actually menstruating, when you have your period, your estrogen is actually pretty low. And that's when, theoretically, according to what we think, you should be protected. When estrogen is higher, that's when things get more loosey-goosey. And that's when we think that ligaments are potentially going to tear more. So there's a few studies that show in the late follicular phase, meaning right before ovulation, so that's kind of halfway, about as far away as you can get from your period, is when there's most of the injuries occurring. But there's also data showing kind of the opposite. So we still need more information on it, but the answer is that's definitely a myth.
How often do you see ACL tears in women's football?
Way too often. Way too often. I would say multiple a year in each team that I've been with, and right when you see it happen on the field, you kind of know that it is an ACL, which is terrible to say, but I don't wish that pain for anyone because I've dealt with it, and it was definitely a very hard injury to deal with.
It's a long road, yeah.
Yeah.
Did you notice the difference high school versus college versus pro? Because the medical data suggests that high school level, even middle school, are tearing a lot more than older.
Really?
Yeah.
I would say I experienced a lot more ACLs in my college years.
College?
Yes.
Yeah, high school, college seems to be the window, and we're not totally sure why. Maybe there's something about the joint laxity. The training is a big thing too. There's some studies that suggest that up to 25% of female adolescent athletes, specifically soccer, basketball, or volleyball, are gonna either tear an ACL that's already been injured or the other one. So if you have an ACL tear, you're probably gonna be back, but luckily that has not happened for you.
No.
How does fear of re-injury impact your confidence on the pitch?
Since we're talking about ACLs, I would say it's a huge fear that I dealt with. I did tear my ACL in high school, and it took 10 months to get back to the field just to be sure and be safe. I was cleared at 6 to 7 months, but I had that fear of it happening again, so I wanted to make sure that I was 100%, even more healthier than I was before I tore my ACL. So I think just preparing myself helped me not have that fear.
Yeah, the mental strength is really important, and even compared to when you had your surgery and injury to now, just in that not that many years, we've learned a lot about psychological readiness to go back to play. And the physical therapists who manage ACL surgeries always joke that they're half physical therapist, half a psychotherapist, because there really is, it's important, because almost every ACL tear that happens in an athlete, it's gonna happen during a game, right? And then being on that pitch again is terrifying. And the other thing with ACL injuries that is hard to wrap your head around is that even once it's fixed and you're good and your quad's super strong, it still doesn't feel the same as it did before.
Scary.
And how long did that take you to feel normal again?
Funny story, but the first game that I had back from ACL surgery was 10 months after, and I had my brace on.
Yeah.
My doctor was like, you have to wear your brace, and I had the brace on. I didn't feel normal. Mid-game, I ripped the brace off, and I flew it at my mom, and I was like, I'm not wearing that ever again. And honestly, it didn't take me as long as I thought to feel normal again, just because I prepared myself leading up to that moment.
Is there a negative effect to Leah removing her brace during a match?
Regarding the brace, kind of depends. So modern day, we don't really need that. I'd say it depends on how you're doing. If you have some residual laxity or maybe some slight strength deficits, then it's always safer to brace, but we all hate them, right? Nobody's comfortable in a knee brace. So the whole goal in reconstructing the ACL is that you don't need a brace because your knee's stable. So we're really moving away from that, and any physical therapist hates knee braces, as I'm sure you've learned.
I was literally gonna say, my current PT, like, he's like, if you need to wear a brace, you shouldn't.
Yeah.
If you don't feel good enough to play without a brace,
wrong.
then maybe you shouldn't be
Exactly.
playing. And I honestly agree with that.
Yeah.
I don't know, most people, some other people might not agree with that, but.
Yeah, I think bottom line is it's not going to hurt if you wear it, but most people aren't able to play at their full capacity, and there's not very strong data to say you must.
What food groups do you prioritize before a match?
Pre-game meal. Well, what we are given is a lot of like pasta, chicken, veggies. So I try to I actually go kind of heavy before a game. Some people go light. I go heavy and eat a lot of pasta and fruit and stuff. But
like, were you talking a few hours before, right before you walk on?
No, a few hours before.
Okay.
Like if our game's at 7, eat around 3,
okay.
I would say. And then I like snack, a little banana.
You're actually wrong, because everyone's supposed to eat a cheesesteak right before. That's what all the medical science shows. No, I'm just kidding. You're right. So a few hours before, carb heavy, little protein, and then right before it needs to be something super easy to digest, because everyone's made that mistake of eating like peanut butter, or something fatty before, and then you have trouble during the game. So yeah, banana granola bars, something like.
You like goldfish?
Quick and easy. I approve of goldfish.
Okay,
yes,
perfect.
carbs, easy to digest.
In what ways does having a female doctor positively impact your experience?
Yeah, so much. I love having female doctors. I think just like there's a different trust, I think, for me. Like I trust that a female doctor hears me when I speak to her, and I think also just, I don't know, being able to relate more about certain things. I trust that a female doctor like has done the research on female athletes compared to male athletes, or
Some of us have, yeah. Some of us have
consider
done
it
Some of us
more
know it.
maybe.
Yeah.
I love having female doctors. So
Yeah, and from a doctor's standpoint, having worked with plenty of male pro teams in the past, there's something to be said for it, like not being weird when you're examining someone's glute in the locker room, right? And like just being in there as female doctors, female athletes, and we have this whole amazing center at NYU where we've got, everyone's gonna need to see a gynecologist at some point. Everyone's gonna need to see an internal med, and we've got all these different things available for everything you need. So we love you guys too. Hi, I'm Dr. Abby Campbell.
And I'm Dr. Natasha Desai.
We're here at NYU Langone Center for Women's Health.
And we are the official team doctors of Brooklyn FC's women's team.